Some people assume that savings, health, or disability insurance, or Medicare and Medicaid will cover their long-term care expenses. While each of these elements may play a role in retirement and long-term planning, none is an appropriate financial strategy for long-term care on its own and may not cover the full cost. Here's a look at how these elements work and how a tax-deferred product such as a fixed annuity with long-term care benefits can help fill in the gaps they don't cover. In general, it's a challenge for most people to save enough to support their financial obligations in retirement and pay for long-term care. Health insurance helps pay for medical costs. For example, it typically covers skilled nursing home care following hospitalization, but for no more than 100 days. It also usually covers medically necessary home care. However, health insurance does not cover adult daycare or assisted living arrangements. Disability insurance replaces a portion of your income in the event you become disabled and cannot work. It generally does not provide benefits to those older than 65, which is when you would most likely need long-term care. Medicare covers only medically necessary care for those 65 and older. It focuses on expenses such as doctor visits and medication, as well as care for illnesses that are expected to improve over time. It does not cover the care you may need if you are unable to perform basic tasks known as the activities of daily living, or ADLs, such as eating, bathing, and getting dressed. Medicaid covers medically necessary care, long-term care services in nursing homes, and those provided at home, as well as personal care required to perform ADLs. Medicaid eligibility and services vary by state, so it's important to research the laws where you live. Medicaid is meant to help low-income individuals with medical expenses, which means personal assets cannot exceed a certain amount in order to qualify. You may have to spend down a majority of your savings before being eligible for Medicaid benefits. Long-term care insurance is an option that can help protect your retirement savings and provide funding for long-term care services. But long-term care insurance can be expensive. And if you don't use it for long-term care expenses, you may lose it. Also, any unused insurance assets may not be passed on to your beneficiaries. While your savings and other insurance can help cover portions of your long-term care, a tax-deferred product such as a fixed annuity with long-term care benefits can help fill the gaps and ensure you stay on track for retirement. Talk to your financial advisor about a long-term care strategy today.